All right, in this lecture, we're going to talk about the terms evaluation and assessment. It's important that you understand the difference between the two. First of all, assessment is defined as the process of gathering data about an area of learning through tests, observations, work samples, and other means. So here's a comparison that will hopefully help you make sense. The assessment piece is that when you're sick and you go to the doctor, a doctor collects, he talks to you, then he collects blood work, x-rays, samples, maybe clinical observations, if you know people who have done like a sleep study. All of that is the assessment part. He's gathering information together so that he can make a diagnosis about your treatment plan or what's wrong with you. And all of that is exactly like what we do in education. We gather information about how our students are performing and what they know and what they don't know. And we do that through, not just giving tests, but observations and gathering their work and talking to them, working in small groups and such, all so that we can eventually evaluate their progress. But the assessment part is when you're just gathering all of that information. So the evaluation side is when you use that process of then taking the results from all of your tests and observations and work samples and anything else you use, and then you judge the effectiveness of a program. That's connecting it directly to education. The effectiveness of this curriculum I used or this teaching strategy. How effective was it in helping my students learn? Our analogy continued. Our doctor then takes all of the test results that we got back and he looks at everything, compares it to what he knows, and he says, okay, here's your diagnosis. Then he creates an order for your treatment, and then that treatment is monitored by the doctor so he can track your progress. Sorry. So for me, I have a thyroid disorder. And, once they diagnosed that, now they have me on medication that I'll have to take the rest of my life, but that medication has to be monitored. So every 4 to 6 months, I go in, I have blood work done, they look at the numbers, and then they decide whether or not to adjust my medicine. And then if they adjust it, then, I come back, I have more blood work done, and they look at it, and so on and so on. That's the evaluation piece here. This model is really important that you understand all of this process in the classroom. So the assessment model has 3 parts to it: the assess stage, evaluate stage, and the modify. You can really jump in at any point in this circle. You see it just rotates around clockwise. But here we go. Let's say the assessment piece. You collect data. So you given a test, or you've looked at their homework, or you've watched them in small groups or whatever, but you've collected all of the information. Then you evaluate that information, and what you're deciding is, are the students learning, and also how effective are your lesson plans or the materials that you're using to teach with. It's actually more about your teaching than it is about the students most of the time in the evaluation. And that's pretty key that you understand the difference. We don't really always just automatically blame the student for not knowing enough, working hard enough, learning enough. I mean, certainly there are times when that happens. They're not doing their homework, they're not paying attention in class. But more often in the assessment model, what we're saying is, are my lesson plans good? Are they effective? Are they working? Or do I need to change them? And that's where you slide down here into the modify part. That's when you say, okay, I've collected the information, I've evaluated it, and now I need to decide, do I need to make changes or not? And a lot of times maybe you change a teaching strategy, or you decide to add a different kind of resource or a different type of activity, and you make a modification. After you make that modification, then you have to see if your modification was effective or not. So you just go right back into the cycle again, and you collect more information from the students, you evaluate it, you make changes. This is continual in the teaching classroom, right? It can be on a large scale where we think about big units that we create, but it's also happening in the moment. I mean, sometimes you have a lesson and you think it's going to go really well, and then students are just not getting it, or they're not engaged, and you have to make adjustments right there in the moment so that you can not waste time. And then you make those changes, and then immediately you're checking to see if students are responding, are they understanding, and so you just continue along through this process. The assessment model is really important for teachers to understand, and it's, to me, it's the this is where the art of teaching comes in, the craft of teaching, because you do have to do this quickly sometimes. It's not just always when you plan great big units or projects for your students to complete. All right, so why do we assess? Well, the number one reason that we assess students is to guide our classroom instructional decisions. It is not to give grades, okay? It's not. It's all about deciding, is what we are doing as teachers working or not? It's about us. It's about informing us so that we know, yes, that's working. I should keep doing that. That was a good change. Or no, this is not working. I need to adjust. We also assess so that we just have information about what students know and what they're able to do. Sometimes it's important when we assess that, yes, we're checking to see what students retained and what they remembered, but really, what did they not get in our lessons that was really important that we should go back and reteach? Assessment also helps us create plans that support the instructional needs of individual children. Sometimes children need to be challenged more or they need additional support, and the only way that we can really know how they're doing and what they're understanding is by assessing their progress. It's also important that we're presenting students with information about their own progress for personal goals. Right now, it's a really big trend in education that we let kids set their own goals and that we help them monitor how they're doing towards achieving those goals. So for I'm thinking about, like, let's say accelerated reader, if you're familiar with that. The student wants to get so many points. You can help them track their progress. Math facts. Students want to be able to answer 100 problems in 5 minutes. You can, like, periodically give little assessments and then let them actually fill out a bar graph so that they can chart their progress. Some people do this with, weekly spelling tests or whatever. But the whole point is that you are giving information to the students so that they can actually visually track their progress and see how they're doing. Of course, assessment helps us to evaluate our classroom instructional practice and curriculum. That's more about what the district has provided. The district has said, I want you to use this structure in class, or I want you to use this program, and your assessment helps inform the district if those are effective choices or if they should be evaluated and maybe changed. The least important reason that we assess students is to give grades, and to, at the end of the year, you have to promote, assign, or retain students to the next grade level. That is the least important reason why you should be taking grades. So hopefully you understand that now that I've kind of explained it a little bit more. That as teachers, particularly in the early childhood classroom, the grading is more to inform us, not to just assign a letter grade to a student about their progress. All right.